Kevin Wheeler here at Mercy Sports Medicine with Dr. Brian Mahaffey. And Doctor, let's focus on something that's common for a lot of people, and that's the concept of knee problems, knee arthritis in active people.
Sure.
So what are the most common things you hear when it comes to knee pain, arthritis, and things along those lines?
Well, the most common thing that we see in our office with knees is problems with the kneecap joint or the patellofemoral joint. Extremely common in all age groups. And you don't have to have any arthritis with that. And most of the time it's not an anatomical issue that you have to fix. It's how you move, how you function, and working on that. Our thought process at Mercy Sports Medicine is you can strengthen around the knee, you can become more flexible, but if you don't fix the other issues, the why is it happening, you're going to continue to have that. The same happens in any age group if you start developing some arthritis. I have patients of mine, I have an 83-year-old patient who runs half marathons, her x-rays look horrible, to be honest with you. And she does great. It's because she has maintained her movement patterns, her core, and her muscle strength to be able to allow her to go out and do that, and she loves it.
So how common is arthritis? And again, medically speaking, what is it? I mean, what is causing the pain that you're experiencing?
Arthritis is essentially breakdown of a joint, and there can be multiple causes for that. As our population ages and as we become heavier in our population, the rate of arthritis with all joints, but especially with knees, is going up. And so the rate of having knee replacements is also going up, and hips in there as well. My thought process is you want to try to do everything conservatively before you get to have a knee replacement. And one of the best things you can do is to try to maintain your activity. Exercise is most certainly the best medicine. And if you can unload that area and work on everything else, the large majority of people, along with doing some other things with them, either oral medications, icing, injectable type medications, can be very, very active and do very well long term with knee arthritis.
Are some people more predisposed to experiencing that than others, like you compared to me?
Yes, most certainly. If you have a family history of arthritis, that can lead to that. If you've had previous injuries, trauma, if you've caught before, most certainly you can lead to arthritis and a lot of athletic activities. Obesity and inactivity can lead to that. There is a great study that showed that people who have arthritis who sit down more tend to do worse than people who are up, moving around, and active. But it's a catch-22. You have to get that discomfort under control to get them more active. So water aerobics is great. Trying to get out and walk. Do whatever you can to stay active. Exercise is the best medicine.
So we're talking about these in terms of treating it when you have it. Are these kind of the same things that would be preventative in nature? So if you're trying to keep yourself from having it down the road,
sure,
same principles apply? Same
principles apply of staying active, being smart, try to avoid injuries. You can't always do that. But yeah, staying active, and probably the number one thing that you can do to prevent arthritis is not gain weight, not be overweight.
And as far as treatment, and we've touched on some of those things, but there are a number of ways you can medically treat arthritis. Do you feel like there's one approach, a conservative approach or an aggressive approach, or does it really depend on the individual and what their goals are and actually and the level of pain that they're experiencing?
Sure. When I see a patient with arthritis, I always talk to them about a stepwise approach. We try to do things very conservatively, start off with oral medications. Oral anti-inflammatories can be very effective for arthritis, but they also have some side effects. And cortisone injections can be very effective, but can cause breakdown of the joint long term. Viscosupplementation or rooster comb injections can be very effective in certain people. They don't work for everyone, but they can be very, very helpful to kind of maintain your knee, help with the inflammation. And I've had a lot of success in using that, as well as getting people active and moving again. And not everyone does well with that, and there are a lot of people that end up needing to have their knee replaced and do extremely well with it. It's a surgery that we're better and better at doing all the time. But if you do have issues with it and you don't do well, you can't go back and do the conservative things. So my thought is do the conservative things first. If they don't work, okay, then you can move forward from there.
And finally, how about identification? What's the difference between something would be called arthritis and maybe just some normal pain for somebody who has been active, but it pops in here and there?
Sure. It really is, from a pure medical standpoint, looking at the x-rays and if there's any bony changes on the x-rays. But those symptoms are very, very similar. It just depends on the level of the system, of that and where on that progression that they are.
So when you have doubt, find a professional and
Sure.
get more information.
Absolutely.